Welcome to the MHSU Referral Workflow video series. In this video, we will walk through how to review your client's demographic information, as well as learn about the other tabs in the patient information section in PowerChart. This is an important part of preparing a referral and should be done alongside reviewing your client's problems list and updating their gender identity and pronoun information. Let's begin by reviewing the patient information section in your client's chart. When you open your client's chart, navigate to the patient information section on the menu. Here you will see the following tabs: Demographics, Visit List, PPR Summary, Patient Contacts, and Email Information. The first tab is your client's demographic information. In this tab, review your client's demographic details, including their name, date of birth, gender, and address, and phone number. If any of this information is incorrect or missing, which as you can see in this chart, the address and phone number are missing, contact your program admin support to make the necessary changes. The next tab is the visit list, which displays a list of all of your client's encounters recorded in the electronic health record. You can select any encounter to view more detailed information. For example, when you select the top encounter, you can see that your client is an inpatient at the Campbell River Unit Hospital, where they are located, including their room and bed, any healthcare providers involved in this encounter, and what health plan they're using. The next tab is the PPR Summary, which stands for Patient-Provider Relationship. This tab displays all active and inactive relationships associated with your client and can help you identify who has been involved in your client's care. The Lifetime Relationship section here at the top highlights providers with a permanent care relationship, such as a family physician. You can see that your client does not have a family physician listed in their chart. All other care relationships, either active or inactive, are listed at the bottom screen under Visit Relationships. You can choose to view your relationships only or view active relationships only, which will narrow down your view. The Patient Contacts tab displays your client's emergency contact information, which is collected during patient registration and should be reviewed and verified with your client. Selected encounter emergency contacts are specific to the current active encounter. Person-level emergency contacts are the client's permanent emergency contacts collected and validated during patient registration. Additional encounters emergency contacts are historical contacts collected at previous encounters, which may be helpful when current contact information is missing or unclear. You can see that your client is missing their emergency contact information, so you would want to update this through your program admin support. The last tab, Email Information, is when your client has provided their email contact during patient registration. This information supports access to your client's My Health portal account, but is not automatically transferred into Pathways. If your client wishes to receive email communication about their referral, their email address must be manually entered into the referral within Pathways. That concludes our walkthrough of reviewing your client's demographic information in PowerChart, including the other sections in the patient information section of their chart. Keeping demographic information accurate and up to date helps ensure safe, coordinated, and client-centered care. If you have any questions or feedback, please contact the Clinical Data Systems team at mhsu.cds@islandhealth.ca. Thank you.